Preparing for whooping cough outbreak. The purpose of this presentation is to cover findings and suggestions in dealing with the outbreak and containment of the disease. What is whooping cough? Whooping cough is a serious lung infection disease caused by a bacteria called Bordetella pertussis. It is also very contagious and causes coughing fits. It spreads easily from person to person through coughing, sneezing, and breathing, and it can lead to death. Pertussis is a controlled bacterial disease in the United States, with peaks in disease occurring every 3 to 5 years. The Centers for Disease Control and Prevention has reported that there are an estimated of 60 million cases of whooping cough and about 195,000 deaths per year worldwide. Since the 1980s, there has been an increase in the number of reported cases in the United States. Signs and symptoms of whooping cough. Some people have milder symptoms, especially if they have been vaccinated. Symptoms appear in 3 stages. Stage 1 lasts 1 to 2 weeks, and some symptoms are runny nose, sneezing, low-grade fever, mild occasional cough. It may look like the common cold, but the cough begins to get worse. Stage 2 can last from 1 to 2 months. Coughing becomes more severe. There are coughing fits that can be followed by a high-pitched whoop. The whoop means the person is trying to catch their breath. Sometimes a person will turn blue and vomit mucus or food. They also may have brief periods when they stop breathing. Stage 3 may last weeks or months. Recovery phase is when the person slowly gets better. Coughing fits can come back if the person gets another respiratory illness. Incubation period of the disease. Symptoms usually appear about 7 to 10 days after exposure, but symptoms can appear from 4 to 21 days after a person is infected. It is rare, but it can take up to 6 weeks for a person to develop symptoms. Recent studies suggest that patients with asymptomatic infection can transmit pertussis. However, because asymptomatic transmission is not well defined, it is difficult to determine the period of contagion for these patients. Patients are considered non-infectious after 5 days of receiving antibiotic. Complications. Complications of whooping cough are more common in infants and young children. Some of the complications are pneumonia, middle ear infection, loss of appetite, sleep disturbance, fainting, dehydration, seizures, altered brain function, brief periods when breathing stops, and death. Type of treatment. Some of the drugs that are given to the patients with whooping cough are azithromycin, clarithromycin, erythromycin, and TMP-SMX, which is Bactrim, sulfatrim, and Septra. Managing of whooping cough. Some of the ways of managing the disease are performing laboratory testings of pertussis, which can guide both clinical and public health responses, early administration of therapies, isolation of infected person, quarantine of contacts, and also proper planning of mass media is important in dealing with a pandemic. Communicable disease control. The overall goal of communicable disease control are rapid assessment, prevention, surveillance, outbreak control, and disease management. Infectious bacteria reproduce rapidly and can become resistant to drugs if not destroyed completely. Once an emergency condition exists, there must be immediate response to control the infectious disease. Rapid assessment involves the identification of the main disease, obtaining detailed information about the host country in less than 4 days. During the rapid assessment, a team should be built immediately. The leader should assign tasks to each team member and communicate with the host country. Also, prepare a systematic method of data collection alongside experts in statistics. Prevention involves shelter, site planning, cleanliness, vaccination, vector control, and education. Surveillance. This is a data collection phase similar to the rapid assessment phase, but on a larger scale, and primarily involves interpretation of the data collected in order to create an efficient and effective public health response to treat a disease. This involves constantly observing diseases to find possible trends and be able to report outbreaks earlier. Outbreak control. Outbreak control involves preparation, detection, confirmation, response, and evaluation. Preparation covers the setting up of camp with isolation wards, gathering and storage of treatment supplies such as medicine, vaccination, and medical equipment. Detection involves the development of an early warning system for epidemics such as the whooping cough. Response involves confirming the diagnosis, formulating a hypothesis for the source, pathogen, and the method of transmission, writing an investigation report, and controlling the event by treatment, but moreover, prevention specific to the disease. Evaluation involves changing public health policies as needed, writing an outbreak report, and assessing the previous steps in detail in terms of success and quality. Prevention of whooping cough and other infectious diseases includes education, vaccination, post-exposure prophylaxis, reporting, and hygiene. Some examples of hygiene are covering mouth and nose with a tissue when coughing or sneezing, washing hands often with soap and water for at least 20 seconds, or using an alcohol-based hand rub if soap and water are not available.